from Pakistan, and I did also FCPS and anesthesia from Pakistan from your hospital, which is one of the busiest hospital in Pakistan. And on the basis of that FCPS anesthesia, I got the General Medical Council registration. So I'm an ST4 trainee, a high specialty trainee, HE trainee in East of England, Deanery in anesthetics. And
Give some advice to international medical graduates on how they can improve their CV while waiting for their first NHS job.
so first, I said about building your experience.
Hmm.
Do anything while we're studying. And then the thing is like courses as well. As much teaching you can put on your CV. We sadly don't really engage with teaching much.
Hmm.
So if you can get into like try to teach your undergraduates, students, go to your university, ask them. They must have a lot of opportunities, and you can get a letter which helps that you have been actively involved with treating undergraduate students, or talk to your professor, ask them, can I start teaching the graduates when they come to theaters or any other place in the wards, and then you can get a certificate for that. So that really helps. That can be added in your CV for teaching, even in leadership as well. That's one thing. Then I would say research, which is very difficult because I did FCPS. So in that, it's a compulsory to do a dissertation. So I did a research project, which is a really detailed research, and then I submitted it in one of the papers, which was recognized on the um, PubMed. So it should be, if you publish a paper, it should be published in a paper which is a PubMed journal. Otherwise, you won't get points for the training application. So that gave me really good points when I submit my application. So when I submit my application over here, you can even go back, like for your Pakistan evidence as well.
Hmm.
So I used my Pakistani evidence for this research project. Then I used my Pakistan evidence for because I did training, so for like prizes and things like that, I can also add that. Sadly, my distinctions in MBBS didn't work, so they said no, we can't account for that. So that is not. It used to be they used to account that, but they said sadly we can't do that. The CPD points, mostly the courses they recognize more recent. But still, if you're working, waiting for your first job, try to as many courses as well. BLS as well, if you can do over there. Yes, ALS is very different. It's a different over here. They don't
Hmm.
recognize the American one because in Pakistan we do the American one, and over here it's a British one. But even if you've done the American one, at least it's written on the CV that you've done
Hmm.
BLS or ALS, they will be happy. So, and try to do some audits. It's difficult over there because I came here, then I knew what an audit is. But I
Hmm.
think now juniors have more insight into what an
Hmm.
audit is. So they can do like small audits, small projects in the hospital, complete it, submit it in few conferences. Because I know back home, my professor, uh, he still encourages students to go to international conferences, and they are presenting in different conferences as well, in Pakistan as well. So I went to Pakistan on holiday and I presented my QRP project in UK, in Pakistan, and I got a first prize on that. And I used that first prize to submit in my training application. So you get like 3 or 4 points easily like that. So so yeah, that also helps in your building your CV. So that's the quick, easy points.
Hmm.
So even if you're doing for the first jobs, if it shows that okay, you've been doing teaching, you've been doing projects, you've been doing something extra rather than just studying, so that helps.
This was very helpful. The teaching
Yeah,
part and the audit part, because these
yeah,
things are not normal in Pakistan.
yeah.
Nobody pays any heed to teaching, or people even don't know that what exactly an audit is.
Yes.
So I
Another
think
thing
it's
which I didn't do, which I should have done, is a logbook. Because I did have a CPSP logbook. It's called the Physician of Pakistan training, and we had an online logbook. But I don't know why there was no printable option of that logbook. So there was no download option. There was no printable option. So I didn't have any backup of what is online. So I had
Hmm.
cases on that, but I couldn't retrieve it.
Hmm.
So I either make another copy a Word, Excel, which is, I know it's very difficult, or use your own phone. There are very a lot of like free softwares for
Hmm.
log. When I came to the UK before getting the lifelong learning platform, which is a Royal College platform, I use like a free logbook.
Hmm.
There's a lot of apps on your phone. So if you can keep on adding stuff in that as well. So that also had a downloadable option. So if I had done that, so I would have had a logbook, which I could
Hmm.
easily put in my portfolio now, and which builds up your cases. It's like it would have been like thousands now. So in the ARCP especially, they look at like, okay, background. So it's easy for people to sign off you. So if they look
Hmm.
at like easy to get a first job or any job, so that you can also add in your portfolio when you get a UK portfolio.
Can
So
you
yeah, first
can
thing
you
in the UK.
share the name of the logbook app as well?
Okay, yes. So for us, it's a lifelong learning, Royal College of Anesthetists membership, but that's a paid one. That's
Hmm.
compulsory for anesthetists when they come here. It took me 6 months to realize that. Then I got it. But the first thing I would say to anyone doing an anesthesia to get that logbook and then start filling in that. But they are like, I don't remember the names, but there was a logbook. If you Google it, I think on the App Store, they were like free downloadable logbooks with down just make sure they have a download option,
Hmm.
and it doesn't matter, it's the same, like the format is almost similar. You
Hmm.
can add your cases, age, case number, and that's it. It doesn't take too much time. We used to think in
Hmm.
Pakistan, oh, the logbook takes ages. Just do it at the case. Once you do the
Hmm.
case, just put it over there. That's how I work in NHS. I never do the logbook at home. That's one thing. I can do the work-based assessments afterwards, but logbook, no. Do it right away. Otherwise, it's very difficult to do it in back dates.
Yes, I understand. Hmm.
Yeah, you understand as well.
Because if you take that to home, you will always spend all your time at home doing the. Because in the
Yeah,
start, when I started doing my portfolio in the GP
yeah,
training, in the start
yeah,
I was always doing it at home, and I was never free. I never had time for myself. But now I have realized that whenever I'm free at work, after the
yes.
rounds, when I'm done with everything, I just go and log in my portfolio and start doing the stuff.
Yeah, even if you're having a coffee or something and you
Hmm.
remember, okay, these are two cases I've done. I just put the logbook
Hmm.
quickly. And the workplace assessment that as even if I don't write it out, because it takes like 5-10 minutes to write an assessment. So even if I don't complete it, I just save it with the
Hmm.
date and the few details, like one or two.
Hmm.
And after that, I can just sit down whenever I get time, even at
Hmm.
work afterwards, and easy to complete it. So that's few tricks which I've learned.
Hmm. Otherwise, sometimes we also forget the cases, and sometimes I forget to
Yes,
note the MRN number, so I forget
yes,
the case totally. So that's why I think it's very important to just save that at that
yeah,
moment with a few details, and you can write it whenever you're free.
yeah, yeah,
Mhm.
yeah. So it's much easier like that way. Yeah,
These things that you mentioned, teaching, logbook, and the audit were very important. And I think this is literally the most important part, other than the pathways that
yeah,
IMGs need to focus on, because
yeah,
these things, we do not have awareness about these in Pakistan or in any other countries. So we really need to focus on these, and these can help a lot in getting the first job.
yeah.
Now, I think is there anything else, any other advice for people who are planning to go opt in for anesthesia in the UK? Any advice, any general advice? Anything
Yeah.
that we have missed so far?
No, not really. So yeah, experience firstly. That's what I said. Get the logbook.
Hmm.
I mean, the Royal College needs this membership as soon as possible when you come to the.
Hmm.
And then exams as well. If you want to get into higher special training, you'll have to do the primary exam. Sadly, anesthesia exams are hard. They're not
Hmm.
easy. So you need to
Hmm.
be ready for them. It's a lot of pharmacology for the first one,
Hmm.
physiology, the basics in the first part, and the written is a bit clinical, but still the primary comes again in that. So that takes a lot of time to do the
Hmm.
exams. So be prepared for those exams as well. And other than that, it's a competitive and busy specialty. It's not
Hmm.
an easy one like people think. It's like, okay, it's like an 8 to 5 job. No, it's like the training or or the job for anesthetics. It's like you get long days, you will get nights, you will get like and you will be busy. You'll go to IT, you'll go to pain. There are like a lot of other parts of anesthesia.
Hmm. So now coming to another, my favorite part, that what challenges have you faced as a woman in the field of anesthesia? I want to know about your experience in Pakistan as well as in the NHS.
In the Pakistan as well in the NHS, as a woman, I think especially in Pakistan, they it's a very male-dominated
Mm.
still field. You will see a lot of male doctors, especially except for labor ward. Yes,
Hmm.
that's another different part. So you will face like they were like, why are you doing such a rare field? And it's like uh they are like so easy. Why don't you go to gynecology or
Hmm.
like simple dermatology or like some easy fields? So that's a few challenges you have to face as a female. And there's a lot of leadership involved with anesthetics. So once something gets wrong in theaters, so you have to take the leadership role. And as a female, it becomes very difficult because there are a lot of male dominating surgeons and your senior colleagues, senior consultants as well. So you have to deal with them. And it's also very difficult to deal with difficult surgeons if you have to postpone a case, supposedly, especially in Pakistan. They used to bring all kinds of excuses, even bring a wrong lab. They're like, oh, the hemoglobin is fine. I was like, okay, no, it's not fine. So it's very difficult to say no to them. Even over here, I remember I once cried after theater because the cardiac surgeon was so rude to me. I mean, he just shouted at me, and I was like, okay, so this is like, so even in the NHS as well, some of the surgeons are like, they're like, they don't really understand, there's a female standing behind.
Hmm.
They are like, okay, they still believe, okay, then this is just what they do is sit and monitor, and we are doing the main part. But they have to recognize that it's an important part. If something goes wrong,
Hmm.
it's you who's responsible for the patient.
Hmm.
Yeah.
Hmm. Thank you
Yeah,
so much for
these
it.
are few challenges, yeah. And
Hmm.
ITU especially as well, once you're doing a ward round, and sometimes the patients are also like, okay, where's the male doctor? So so it's still difficult being a female.
It's 2025 and we still have these issues. I am amazed at the world that it's literally 2025. There is so much
Exactly.
development, but the minds haven't developed.
Yeah, definitely. And especially for pregnant females, so we have to like take care of them. Firstly, in anesthetic, especially over here, we don't use nitrous, but in Pakistan, we used to use nitrous. So nitrous is like you don't have to be around for the first 3 months. So we used to get the females in other parts where the nitrous is not being used, like obstetrics or other parts of the theater. So that's not a problem over here. But the other problems is like obviously if you have to run after doing a CPR, or then you have to learn for a crash call or something. So that's difficult for pregnant females, obviously, colleagues. You have to take care of them as well.
Mhm.
Over here, there's a good like maternity, you get like leave and everything, all that support. In Pakistan, sadly, the females used to work till the last day.
Hmm. Yes,
Yeah.
that is a huge difference that most of people are not aware in Pakistan, that there is a concept of 1 year maternity leave in the NHS. And
Yes.
even in US, it is not 1 year. And
No,
here
it's
it
not.
is paid maternity leave and it's 1 year of maternity leave. You do not
Yeah.
get paid in the last 6 months, but you get a maternity leave. But in Pakistan, there is no concept of maternity leave. If you take a maternity leave during your training, you only get 3 months and you have to
3 months.
complete those 3 months at the end, and that will be unpaid.
Yeah, that's how it is. So they usually the females used to work till the last end, till the last.
Hmm.
And I remember one of my senior colleagues, she had a premature premature delivery just because she was working to the last minute. So
Mm.
sadly.
Mm. Now I'll be ending the meeting with anything that you would like to, any life lesson or anything that you would like to share with all my audience.
Oh, not really. The other thing I would say for the IMG is what I faced is like because the first job I came here and it was the guys in St. Thomas. Shadowing, nobody gave me shadowing, sadly. I asked them as well. I emailed them, even asked them in the induction as well that I have worked before,
Mm.
but still it's a new setup, it's a new country. So they're like, okay, fine. So they gave me a registrar the first 2 nights, but the third night I did it alone.
Oh,
Starting nights as your first job.
nice.
And in ITU, in one of the busiest hospital, it was not good.
This
So
seems
this is
scary.
bad.
Even listening
This
to
is
it, even
bad.
imagining this is scary.
This is bad. So then I was like, that was unfair on me. So
Mm.
so I should have been more firm on that. And
Mm-hmm.
then yes. And the hospital, I mean, it's like you have to raise such issues.
Hmm.
A lot of things because like as IMGs we like ignore those, oh no, we feel like
Hmm.
we have asked them and they haven't accepted our like request, so it's okay, we will have manage. But no, no. If you get in trouble, no one
Hmm.
will back you off.
Yes. So for patient safety, even if you have to take more shadowing, you should
Yes,
definitely go for
yes,
that.
yeah. Yeah. So I mean, if they say they don't, if they ignore it, please be persistent about it. Like, because
Hmm.
I did ask them, but they just ignored it. So there's no, I mean, no harm, no like a shame in asking for it.
Hmm.
And be persistent, be really, really persistent that I need it. And yeah,
I have the same concept about sick leave as well because sick leave concept is not very common in Pakistan.
yeah, yeah,
We do not get sick leave. We have to provide a replacement before getting a sick leave, even if
yeah,
in my house job in Mayo. So when I was sick for the first time working in the NHS, I felt so guilty while applying for a sick leave.
yeah. Yeah, I
It's the
know. I used to
same.
do the same thing, but now like my health is my priority. It doesn't
Hmm.
matter. So I've done shifts with being sick and being like collapsing at the end of the shift, but that's wrong.
That's wrong.
That's really wrong. Yeah, yeah.
Hmm. Okay, thank you so much, Dr. Sana, for your time. We had a really, this was very helpful. A lot of things were new for me, even while working in the NHS. So
Yeah, yeah,
it is going to help a lot of international medical graduates. Thank you so much for giving us time.
yeah, yeah. Another thing I would say, just because in these, the say like in the routine, how NHS busy is it? It's like I would still say, try to make friends, try to use your off days to rest. And the reason why it kept me on going was like because firstly I had family here, that was
Mhm.
really a plus point. The other thing is that I made friends along, and then I travel a lot as well, so that's really helps to
Hmm.
keep you going.